So women who experience pain during vaginal penetration are advised to use vaginal dilators. Vagina is very stretchy and we can definitely dilate it to improve the symptoms. The issue with pain during vaginal penetration is that it creates fear of penetration as women experience pain. So with time it just gets worse and worse because all they can associate penetration is the pain, and the sexual intercourse becomes almost impossible. It's important to change that and create experience of pleasure from penetration and not the pain. In women with this condition, it's quite a process, and sometimes they definitely need counseling, and we use botulinum toxin injection to relax vaginal muscles and stop the ability to contract them. And after that injection, the advice is to use vaginal dilators. Some women might use them even before. Quite often women who had surgery, some type of vaginal surgery, who also experience pain during or discomfort during penetration, are advised to use dilators or vibrator to help their symptoms. When we start using dilators, usually the studies with the size that is woman perceives as a comfortable for her, or the smallest possible for those who struggle with penetration. And some women can't even touch themselves with a finger in that area because of the fear of the pain. So we would start with the smallest dilator, use a lot of lubrication, and the best thing to do is to lie down, have your legs open, sometimes even tilt, put the bum on the pillow, and try to relax as much as possible. And use the smallest dilator to, of course here it's going to be very easy to insert, but basically angle, when we put the lubricant on, we approach the vaginal opening with the dilator, and have your legs open and knees open and floppy. Insert the dilator aiming to the back, very gently. As soon as you have to discomfort, stop, wait, and try again. And the progress from the smallest dilator to the biggest can be very slow. It will not happen on the same occasion. It might take weeks or even months to get to the biggest dilator, and the biggest dilator that you use would be the size of your partner. Once you're comfortable inserting the biggest dilator, you can get your partner to try to insert it for you. Once you are comfortable with your partner inserting the biggest dilator, that's when you progress to having sexual intercourse with the partner without the dilator but with penile penetration. So it's a very slow process, and everyone is going to do it at their own pace. And there's nothing kind of right or wrong. Botulinum toxin injection lasts for about 2 to 4 months. So we really aim to achieve the vaginal penetration of bigger dilator size during that period and create positive experience at that time. Once Botox wears off, if you would manage to create pleasurable experience from penetration, the effects of Botox will not disappear. You will not have vaginismus again because your association with fear would be gone.